Oh, Dr. Dan, thank you so much. Could I have a hug, please?
How about a high five?
Okay, yeah.
All right.
Just like that.
Hi, I'm Dr. Dan, and I'm here today with the lovely Miss Erin Tillman, sex educator and intimacy coordinator. And today we're talking about consent.
Yes. Very important in kink spaces and just in life, Dr. Dan. It's very, very important. So can I tell you a little bit about consent?
Please, yes.
Yeah, so a consent is basically an ongoing conversation between two people to figure out what you're comfortable with. Essentially, at its very core, that's what consent is. And are we in agreement in terms of what we're gonna do? Are we in alignment, and do we know what's actually going to happen between the two of us? That's what consent is. So you just wanna make sure you're doing things with people and there's not someone who's like, oh, I didn't want to do that, or I'm not into that. It's like we want to find an equal footing and where we're in alignment.
So how would you approach that topic with someone?
So there's a lot of ways to do this in terms of like there's exercises I could do, like when you're negotiating with someone or just trying to figure out what you might be excited about with someone. There's things like touch exercises, like you could do a hug exercise. For example, if I were to ask you if I could give you a hug, how would you feel about that?
Are you asking me?
Yes. Could I give you a hug?
Um,
So for me, that would be a no.
okay.
Because you immediately backed up a little bit and your arms folded and there was a hesitation of that's a no for me. And so for me, what I'm always looking for is enthusiastic consent, meaning there's not a hesitation or not a big hesitation and not a folding in of the body, like your body's saying no, even though you might say yes, even though you didn't. I'm aware of it, you did not say yes.
Okay.
So from that, I gathered that you were not interested in a hug.
Yeah, I'm not sure how I feel about a hug at this time.
That's fair. We totally just met, and so I respect that boundary. How about, would it be okay if I touched your arm or hand?
Yeah, that would be okay. I think I'm okay with that.
Okay.
So just,
Yeah. Thank you. So there we go.
oh, okay.
Almost like a handshake, but not really.
Can I maybe,
Yes.
okay. So it's okay if I put my hand?
Yes. I'm a yes to anywhere you want to put your hand on my hand.
Okay.
Yes. So that would be some level of consent. I could build on that and say, could I put this hand underneath or on top of your hand?
Can we try that?
Yes.
Yeah.
Yay.
Okay. I think maybe could we try a hug?
Could we?
I would like to try a hug if it's okay with you.
I would like to try a hug too.
Okay.
Can we? Okay, here we go. Let's do it. Yes. Oh, yes. Okay. Very nice. How did that feel for you?
Can we try another hug?
Yes.
Okay. All right.
Okay, let's do it. Yeah. Okay. How was that one? Anything different?
Can we try a 30-second hug?
30-second hug. That's very specific.
Would that be okay?
I would be okay with this.
Can we do?
Okay. Yes. Good job, Dr. Very good job.
Okay.
That was excellent.
That was good. Yeah,
Yeah.
I feel, I could feel my body kind of sink into yours.
I could feel that too.
And it was, I enjoyed that. I enjoyed that quite a bit.
I did too. I'm so happy to hear this. So that's just one example of how you can negotiate and find something that both of you like in terms of like consent and touch.
Okay, so the takeaways are we ask permission, and if someone backs away from you,
Yes.
that's a no.
Watch the body language.
Okay, so it's not necessarily like a no, but if you're approaching and someone is backing up, okay.
Yeah.
and
Yes.
then we can adjust or try different things.
Exactly. And this is why it's really important to get to know the people in our life, whether they're friends, family, partners, etc. Because people's body language will tell you a lot if you get to know them.
Can I have one more hug?
You know what? Actually, I'm going to assert a boundary for myself and say at the moment, I feel complete with the experience. But this was so nice.
I understand. It was very nice.
Yes.
Thank you.
Thank you. Thank you, Dr. Dan.
What do I do when I just don't want to hug? Because like I have patients that come, and that's, for me, that's a no.
Yes.
But it's a
Yeah.
little tricky. So how would you recommend I navigate something like that?
I would say offering an alternative is a great way to assert a boundary.
So maybe like, oh, I'll do a handshake instead.
Yes. So you could
High
even
fives?
verbally say that. You'd say, if somebody said, could I have a hug? You could say, how about a high five? Or how about, an elbow? Or how about a fist bump? So
Can we practice that?
Yeah.
Okay. So you're going to be my patient?
Yes.
Okay.
Oh, Dr. Dan, thank you so much. Could I have a hug, please?
How about a high five?
Okay, yeah.
All right.
Just like that. So you're not saying no verbally.
I feel complete with that experience.
Me too. Thank you very much.
That was great.
Yes.
That was really helpful.
Oh, good.
Thank you.
Good.